gas, very briefly. We're going to talk about things that are called Mark I kits, which is a way to minimize the effects of someone being exposed to nerve gas. I've given you a quick sheet that will help us get through this. And by the way, I've got 11, maybe I can get through all. We've had a couple really long training sessions recently. And so I can either try to go longer or I can try to go a lot shorter. Which would you prefer?
Shorter. Probably shorter.
Just checking to see if you're with us. Okay. So anyway, so we'll go shorter.
Pre-watch the rocket.
But for those of you who really want to get involved in a lot more details of the chemistry surrounding nerve gas and how it works, and you know, the reactions of your body to nerve gas, Meredith is graduated in biology, and she is more than prepared to take you through this. So for those of you who like to stay later and learn all about the joys of the chemistry of all this, and the biochemistry of it, you know, feel free. I'm an idiot. I don't understand a lot of this stuff. So what I'm trying to do is just to do this, you know, like we were talking to like the 6th grade, 3rd month person. You're all older than that. But this is the simplified dummies only version of nerve gas. So in any case, the body is a very complex piece of chemistry as well as tissue and bones. For the body to work properly, the blood chemistry's got to be right. The chemistry in each of the cells has to be right. There's a chemical called acetylcholine, which is a neurotransmitter, which transmits signals from the nerves to the muscles and to other body systems, and that control breathing, that control heart rate, that control your eyes, that control whether or not you have tears coming out of your eyes and other your vomiting and so on. So that's acetylcholine. In order for the acetylcholine to work properly, there's an enzyme called acetylcholine esterase. And so what happens is this acetylcholine esterase has to be present, it has to be functioning properly to allow the nerves to operate properly. So what happens with nerve gas is it attacks the acetylcholine esterase, and therefore it makes the body become very, very unstable. Is that simple? Does that make sense? So nerve gas attacks acetylcholine esterase, which makes the nervous system and other body systems become unstable. That's the simple part. So that's the kind of the chemistry of all this. So what I did is to make the session simple is I've downloaded something from New Mexico, but this covers really the key things in terms of administering an antidote kit. So nerve agents are toxic, and they are chemical agents, and the names that go with these are such things as sarin, tabum, and VX. And these are major terrorist weapons. And then you also can end up with certain insecticides that you find on big farms and so on that can give you the same kind of chemical reaction as a nerve gas would. So where are we likely to find people that may have come in contact with these substances? Well, mass casualties would be one place that you would find potential people. So if you come upon a whole bunch of really sick people, you can't quite understand why, you ought to at least think, hey, could it be nerve gas or some kind of a poison that's either in the air or maybe perhaps it's it's in the water. The exposure, the duration of the exposure, and this onset of symptoms between exposure and when people start to get sick will depend on the dosage, how concentrated the poison actually was, the nerve gas actually was. So, time is obviously a vital factor. OPQRST, when was the onset? What caused the onset? What's making it better? What's making it worse? Okay, and so just do your standard OPQRST things. As we just followed down here, the antidote in this particular write-up came in 2 different vials, or 2 different antidote administration kits. Sometimes they come in one, everything can be combined, and I'll show you one of those shortly. So, in any case, in each of the 2 tubes, you have injector number 1 would be a device, something called atropine, and I'm going to call on Meredith in just a second to talk about this, maybe but maybe not. And the second tube is peroxidone chloride, and so the atropine blocks the effects of excess acetylcholine and acetylcholine, and dries up any secretions that the patient might be having. It decreases any wheezing they have. Because remember we talked about, you know, the tearing that they may have, the respiratory kinds of issues that they might have. And the 2-PAM attaches to the nerve agent enzyme that normally breaks down the acetylcholine and allows it to return itself to normal activity. So again, in terms of where you might find this on a leaf farm, you might find it again, it's part of the nerve gas terrorist kind of attack. So the symptoms, so they can be mild, they can be anywhere from a runny nose to pinpoint pupils to much more moderate kinds of symptoms. And we utilize the acronym dumbbells as a way of trying to remember what all these things are. So if you have patients with profound diarrhea, urination, the pinpoint pupils, bronchospasms, which is a spasm of the broncho system, you know, emesis, lacrimation is what? Tears, okay, and salivation. So that's dumbbell. So if you have people, particularly a number of people presenting with all this stuff, that's a bad sign. It's a bad sign. And severe symptoms, obviously, loss of consciousness, seizures, and no breathing. So contraindications, there are no known contraindications. If you come upon people like this, and there are a lot of them, particularly, you know, think terrorist attack. So we have, again, in many of the Mark I kits, there's 2 different auto-injectors. In some of them, there's only 1 auto-injector. Okay. Any questions about that so far? Does this make sense? Any questions?
Do you only carry one?
Huh?
Do you only carry one in each backpack?
Yeah, what's interesting is,
For us?
Marilyn,
It's supposed to be 3.
okay.
It's for the crew only.
It's for the crew only, right? And the other thing is, the crew should not be going into a scene where this stuff is there. You know, let the firemen with their masks and stuff, you know, bring the patients to you, right? And so, but this is essentially to protect us. But if you're completely safe and somebody has symptoms, you know, you won't let them see what they do, right? So anyway, this is a real live auto injector. Try not to stab myself. They're open at any notch. All right. So this baby is real, but in this particular device, both the 2 chemicals are in one, so you only have to give 1 injection. But again, in many of the older kits, you actually had 2 different vials behind 2 vials. So what it tells you, you know, you forget about these things. How do I use this? Pull off gray safety release. No, that's this guy. Try not to start myself. Okay. So you pull off the gray safety release. What next? Well, the what next is swing and push firmly the green tip against the outer side of the thumb. Do that. Okay? Hold it there for 10 seconds. This thing is spring-loaded, and you'll kind of hear a little pop when the needle deploys itself. All right? And hold it there for 10 seconds. And count 1,001, 1,002, 1,003, 1,004, 1,005, and so on until you get to 10. Take it out. You don't have to put an alcohol swab on the area before you administer this. You can administer it through clothing. Time is of the essence with this stuff. So particularly it's a fireman, it's turnout pants on or something like that. Just slam it right through the pants. That's okay. And then what are you going to do after that? What do you do for the patient after that? Monitor, sure. So you're going to do vitals. You'll be trying to protect the airway, right? Suction if necessary, because remember, with sludge, when you've got this sludge, you've got emesis perhaps, you've got a lot of tear that may be going on. Secondary contamination is a significant risk. So if someone has got diarrhea and is urinating like crazy, you don't want to drag all that stuff into the ambulance if you don't have to. You want to keep yourself safe, and therefore you might wear what? PPE, right? You've got a gown that you could wear. Or you could also wear what? Yellows, sure, exactly what Mr. Hammer was talking about. So yellows have lots of interesting purposes. Years ago, I had a situation where it was a horrible GI bleed, and what often comes from GI bleeding? Vomiting and diarrhea or feces everywhere. Okay, we walked into somebody's house and it was everywhere. This person was really, really sick, and I think was going to die. I told the crew to put on your yellows. We're not going in here until you're properly protected. And so I think we have covered it. Would someone like to? Yes.
Is there a danger to injecting yourself with it if you actually haven't been affected by a nerve agent?
I would think that's not a very good idea.
Your heart rate will go up.
The atropine will probably make your heart rate go up. Yes. Okay. Anything else? All righty. Would anybody like me to stretch this out longer? One more. See, Meredith, for any tough questions. Other than that, you're out of here.